Hey, Brandon Hepner here again, and in our last video I talked about the most common tendon and muscle in your shoulder that's injured, that's one of the rotator cuff muscles. And in this video I want to talk about how we grade the severity of those tears and injuries to any rotator cuff muscle. So let's dive into that right now. So how we do that is we just grade them, or the severity is graded grade 1, grade 2, and a grade 3. It's pretty simple. So a grade 1 tear is basically just some of the fibers are stretched a little bit, okay? With proper treatment, those usually heal in 2 to 3 weeks and get better pretty fast. So that's a grade 1. A grade 2 tear is actually where some of the fibers are torn, okay? This is usually a little bit more painful. People have pain raising their arm up over their head, maybe behind their back. And a lot of people with a grade 2 tear will also complain of night pain when they roll over onto that painful shoulder. So that's a grade 2 tear. Again, a grade 2 usually responds really well to physical therapy and some of the things that we do here at Rock Run. So that's grade 1 and grade 2. A grade 3 tear is actually where all of the fibers are torn, and you usually have a separation from the muscle itself in the tendon somewhere, so it's not connecting to the bone anymore. When that happens, a typical movement pattern that we see in the clinic is somebody will try to raise their arm and they'll do this, okay? They'll kind of hike their shoulder, trying to compensate with some other muscles in and around the shoulder to be able to raise their arm. And so that's kind of a typical movement pattern we see with the grade 3 tear. Good and bad news to these 3 grades is grade 1 and grade 2 typically respond really well to physical therapy and what we do here at Rock Run Physical Therapy. Unfortunately, the grade 3 tears, that complete separation, that's usually a surgery that's required to fix that. We have had a few people that maybe aren't good surgical candidates for one medical condition or another, and they elect to try physical therapy with a grade 3 tear. A lot of times we are able to restore some motion and get them a little more functional and with a lot less pain. But in order to fix that tendon, a surgery is required. So most of the people with a grade 3 end up having surgery to fix that. So the next video that I want to send you is we're going to talk about the single biggest mistake that people make that end up taking them from a grade 1 or grade 2 down to a grade 3 and end up having to have that surgery. And we want to make sure that you are able to avoid that if you're still in this grade 1 and grade 2 area, that you don't get down to that grade 3 and end up having to go through a painful surgery with a long recovery. So look forward to getting that email and that video in the next couple days, and